Thank you, member. Recognizing member from Vancouver West End.
Thank you, Honourable Speaker, Honourable Chair. I want to thank and acknowledge my colleague from North Vancouver, Seymour, for her passion and work around mental health and addictions. I know it's something she's been interested in for many years, along with her other colleague in North Vancouver, Lonsdale, who tells me a lot about these issues too. I also want to thank and acknowledge the Minister of Mental Health and Addictions, because we, since 2017, have a minister responsible for this file, for developing the plan, for developing the roadmap forward. There's a quote that I think about quite often when I think about mental health. It's attributed, I believe, to the former Provincial Health Officer, Perry Kendall, when asked about what gaps existed in the mental health system in British Columbia. This is in 2017, I believe. He said that, well, you have to actually have a system in order to identify gaps, and we don't really have a mental health system in BC. And I would agree with that statement. I think there are pieces of systems, but as of yet, there's still much more work to be done to have a fully integrated system that works for everybody. I am encouraged. Sometimes, I must admit, looking at the state of things, it can be discouraging. I think back to my time in opposition, the previous 9 years, where I would have somebody who was on the street, clearly suffering with mental health issues, clearly suffering with addiction issues, homeless. They would eventually, in many cases, be identified, end up in hospital. They would have one issue dealt with, and then be discharged right back to the street again. And it was a cycle, again and again and again. I would plead with previous health ministers, I would plead with the local health authority, the police, anybody. This person is clearly ill. Why are they keep being discharged back to the street? Well, I was told there were no resources, that wasn't the government's priority, that person basically, the police could deal with them or somebody else could deal with them. Well, Honourable Speaker, in 2 cases that I know of, a person who was identified as clearly having a mental illness, clearly needing help, into hospital for treatment. They ended up dying on the street, Honourable Speaker. They ended up dying on the street because there wasn't housing. There was no place for them to be sent, if even there was an access department within the hospital to help triage them into that housing. There was just no housing, no transitional housing, no shelter, because previous governments had not made that a priority. And so, again and again, the community would step up. We all knew who these people were. We were all trying to find ways to get them help, but they ended up back on the street after being treated for one illness, and often the police would come and pick them up the next day, bring them back to the hospital because clearly they were not well enough to be on the street. But the hospital had nowhere to send them, so it was a revolving door. Honourable Speaker, that is changing. And I've got to say, it's changing finally. Far too late for too many people, and it's not fast enough for the people either, Honourable Speaker. Government moves slowly when, of course, when you're in a crisis, you need an urgent response. But I was pleased 2 years ago to be able to go to St. Paul's with the Minister of Mental Health and Addictions to open the hub, to open an emergency department integrated with the Vancouver Police Foundation's Transitional Care Centre at St. Paul's, right next door to the Rapid Access Addiction Clinic. Because those kinds of centres, that integration that now exists at St. Paul's, that was not in existence for my previous 9 years in opposition, is helping immeasurably. When somebody goes into that system, they're no longer get their wound treated and just sent back out onto the street. No, they're given time to recuperate. They're given time and access to staff who will help them transition into housing, help them into addiction treatment where if that's appropriate, help them with mental health treatment where that's appropriate, to try and stop that revolving door. St. Paul's Emergency Department reports that the number of people, the crowding, the congestion that had become such a huge issue over the previous, 10 years, about roughly 2008 to about 2017, is on the way down again. It's not crowding in that way because people who were in there week after week after week because they were not getting the addiction treatment, they were not getting the mental health treatment, they were not getting into housing, so they were getting sick again once they were on the street. They're now getting access to better care than they had before and into an integrated system of care. So I really want to thank everyone who works at the Hub at St. Paul's for taking that on. But I also want to thank the Finance Minister for building modular housing, so we have places that these people can actually get into housing, not just be sent back onto the street.
Thank you, member.
Thank you, Honourable Speaker.